ready? You got me running.
I am Meredith Hirsh, and this is Working Healthcare. I loved the energy of the interview guest that you are about to hear. It is Herold Figareau, and he has amazing background. He has been all over the state of Florida, from Winnie Palmer Hospital in Orlando to the University of Miami to Bethesda Health to Baptist Health, and he shares tips on how to create the best patient-centered healthcare facility. He talks about recruiting and cultivating your staff. I love the phrase he used, which is cross-pollination of skills. I'm actually going to take that from him. He has been involved in mergers and acquisitions and talks a lot about company culture, either creating a new company culture or blending the multiple company cultures, or even maintaining the existing company culture of the parent institution and how to integrate the various acquisitions within it. We talk a lot about the difference between working in a hospital or a private practice, and that is the world in which he lives now. We end it with why doctors need to learn the financials of a practice. And that's just the truth. The doctors and clinicians need to understand that this is a business and understand the business side of medicine. Herold Figareau, welcome to Working Healthcare.
Thank you very much, Meredith.
I'm so excited to have you because you have a interesting background where you actually started out in the hospital sector and then migrated over into private practice. And most people do the reverse. So I really want to start at the beginning. How did you even get into healthcare?
Oh, that's a very good question. Well, hello to everyone who's watching us now. This is a great show. It's a great podcast. I really want to congratulate you, Meredith, on this podcast.
Thanks.
Healthcare professionals need this. We don't have too many of this type of podcast. And what you bring to the podcast game industry, it's phenomenal. So first of all, thank you.
I really appreciate that. And just for those listeners, we actually met through LinkedIn.
Yes. We met through LinkedIn because I saw you posted an interview with Dr. Ferris. And Dr. Ferris, she's an amazing provider in the community. She's an amazing teacher in our community here in Palm Beach County. And I have so much respect for her. She's helped me when I used to work in the private sector, and she supported my providers so much educationally. So when I saw that podcast posted, I was like, "Oh, who's interviewing Dr. Ferris?" And then I listened to it. It was an amazing podcast, and I listened to more of your episode, and I was like, "Wow, this is what we need." So I really love that. The approach that you take.
I appreciate that.
You're
and
welcome.
I really liked your story because of the migration from the hospital sector into independent medicine and what you're doing in Palm Beach. But again, how did you get started in healthcare?
So I grew up here in Palm Beach County. I grew up in Boynton Beach on Seacrest and 10th Ave. I went to Carver Middle School, went to St. Lucia's High School, and I went to Palm Beach State. And then after that, I went to University of Central Florida. And while I was there, I used to work in the hospital. I worked at Winnie Palmer Hospital while I was in college. Before it was even open, I worked in the concierge department. And I just love working at the hospital. And the reason why I went to work in the hospital is because prior to that, I was working in the hotel industry. I worked for all the major hotel chains in Orlando. Of course, it's very popular for you to have the hotels there. And one day I got up, I was like, you know what? People in the hotel hospitality industry, some of them are grateful of the work that we do. And I used to work front desk. But I said, you know what? If this service I was providing, this customer service I was providing, if it was for people in the hospital, patients, I think they would appreciate it more. So I just got up and quit my job one day. And I told my boss, listen, I'm leaving. I don't want to do this anymore. And I took about 2 or 3 weeks off. And I went online at the time, and that was the early 2005, 2006. And then I went online, and the first job I searched, first job I found was Winnie Palmer concierge at Winnie Palmer Hospital. I was like, what is concierge at a hospital? And I kid you not, in Orlando, Winnie Palmer, it's a hospital for women and babies. And I applied for the job, and I remember it clear as day. At the time, I was dating my wife, and she had given me a pink shirt, black pants, and black shoes in a pink and black tie. So I went to the interview not knowing exactly what it was, and I showed up, and then the hospital didn't open yet. So I went in there, and I'm sitting, and the manager came out to get me. And she said, well, you're dressed for the occasion. I was like, what do you mean? She's like, you're wearing pink. This is a hospital for women and babies. And I just loved it in there. I loved it working in concierge. Then I worked my way up to the patient accounting department. And then from there, my career just took off. I had some great mentors to mentor me. When I worked in Polk County, I moved over to Polk County in the hospital setting. So it was a great transition, from hospitality to healthcare. That's how.
Do you think that patients appreciated you more than guests who were staying at the hospital?
Guests who were staying at the hotel? Absolutely. Yes, absolutely.
Really?
Oh my goodness. I saw the appreciation because when I transitioned, I started working at the registration department in the hotel. I mean, in the hospital. And they love it. The compassion I would be able to show, and the care I would be able to show to the family members. They loved it all the time. So yes, absolutely.
I like that. It reminds me of the first person that I hired for our front desk team, and her degree was in hospitality management, and she had worked in the hotel industry, and she had moved out of town and wanted to come back to South Florida because her family is in South Florida, and that's where she went to high school and grew up. And I said, I don't even care if she doesn't have healthcare experience. She understands customer service.
Absolutely.
And that is what we need in healthcare. People forget it.
You're absolutely right. And I've encountered multiple individuals, and I've hired multiple individuals without any healthcare experience, but they've been in the hospitality industry for so long. And when they do that transition, it's kind of like, wow, where has this person been? And I completely agree.
I teach a customer service class at FAU, at Florida Atlantic University. And I think a lot of the students who are in the class are like, why are you teaching customer service? And I have to explain, you have two customers. If you are in healthcare management, you have two customers. You have your internal customer, and that is your employee. And then you have your external customer, and those are your patients. And without your patients and without your employees, you don't get paid and you don't have a job. Yep. So let's bring it back and say, okay, this is why customer service is so important. But I think in the healthcare arena, we forget about that. And we think that patients should be grateful that we have walked in the door. And I say we, meaning healthcare providers, even though neither you nor I are clinicians. But the mindset needs to change. We need to somehow change it to, we are here for the patient, not the patient is there for us.
Absolutely.
And so you were in Orlando, you came back down to South Florida, you worked at the University of Miami in their clinics and migrated into very large hospital systems. Could you give me a little bit of background about what you did in each location and why you ended up leaving the University of Miami hospitals and clinics and moved over to Baptist, actually?
Absolutely. But before I tell you about University of Miami, my folks over at Health First out in Melbourne in Brevard County, I spent several years out there within the 4 hospital system there. I had such a great time. Again, I was very young. I was in my early 30s, and I had such great experiences over there. So from Polk County over Heart of Florida Hospital, I was recruited to go over to Health First. And it was just an amazing world. education they provided me, the growth opportunity they provided me to be a young leader. And I was just amazed by that experience. And the employees who worked for me there, I was a manager of financial clearance there for all the 4 hospitals. The employees who worked for me, many of them were a little bit more mature than me, or had, they've been in healthcare longer than me. So I learned so much from them as well. So from there, my wife and I, we said, you know what, let's come back home to Palm Beach County. And we're just going to come back home because we were down here almost every weekend and we have our families here. So while we were in transition to move down, I was coming down here to start a business. And I love University of Miami. I went online. I saw this job posted at University of Miami.
What kind of business did you think you were going to start?
So that's the funny thing, right? I was moving away from healthcare at that time.
Why?
I was like, I don't know. I have no idea. And I think I know why, actually. Because when I was in Melbourne, I also have that entrepreneurial spirit. When I was in Melbourne, I had a love for selling cars. So I used to buy cars and sell them and so forth, and buy high-end cars and sell them. So I was like, you know what? I'm going to come down to Palm Beach. I'm just going to transition and start a business down here. And had
buying
a whole
and
plan.
selling cars?
Yeah, selling cars.
Isn't that like the antithesis of somebody working in healthcare?
Well, and that's what a lot of people think, correct? You have to do it correctly. If you do it in an ethical way, you have to do it ethically and do it right. Don't take advantage of individuals. So you do it in an ethical way. It's kind of almost, it's in a way you serve in a community. But at that time, that's what I wanted to do. And maybe it's because I wanted to come back home so much. I was like, listen, I'm just going to come down here and do this. But I saw this job at University of Miami, and I love UM. And it was the same job I had in Brevard County. And I was like, you know what? I'll just apply for it. What could hurt? I applied for the job, and then they called me for an interview. And I went. I was excited. I went to the interview. I was like, you know what? We're gonna live in Palm Beach. Miami is far. I'm gonna go to the interview anyway. And I went to the interview. I was interviewed by these amazing individuals. And these are the individuals I'm still in touch with. We still talk till this day. And, I'm talking about since 2013, 2014. And amazing interview, amazing individuals. And I was like, oh my goodness, these people are the kindest, nicest individuals. And then they offered me the job. And I told my wife, I was like, all right, I'm going to do it. I went for the interview. They said I'm the right person for it. So I was hired to build a financial clearance department for the University of Miami physician practice, which is, all the practices from Palm Beach Gardens all the way to the Keys, all the way to Naples. So we had at the time over 40 practices.
Yeah, and I don't think people realize that because my husband did his training at the University of Miami, Jackson Memorial Hospital. And so we were on the Jackson Memorial Health Plan. And it wasn't that I had to go to the University of Miami because let me tell you, I'm not having a baby at the University of Miami. And I had 2 of those children when I was on the JMH Health Plan. But they have satellite locations.
Yes,
exactly.
all over, yes.
So we lived in Weston, which is Broward County, and my husband was down in Miami-Dade, the University of Miami, and there were Weston satellite locations. And now oh my goodness, they've expanded.
Oh, yes.
They must be all over Florida now.
Yes, they're everywhere, everywhere now. But at that time, I didn't know what I was getting myself into. But when I got to the university, the experience was amazing. The innovation that's there, the support that you get from physicians, from, the administration, for the system overall. And we had a department of about 400 employees, and I was one of the managers in that department. It was just a great experience. And that's how I ended up at UM. And then, I was there for almost 3 years, and we were still living in Palm Beach, and I loved the job. My wife was like, listen, we need to...
You were driving from Palm Beach to Miami?
Well, the great thing about it is because we had the satellite locations, they were under my directions as well, as far as from the financial clearance perspective. So I would be able to work at these different locations in Palm Beach. We have Boca, Palm Beach Gardens, the Bascom Palmer location. So Deerfield. So I was able to work in this area a whole lot as well.
What was your background to be able to work on the finance side of these physician programs?
So the background from the finance aspect is my experience over in Polk County, Heart of Florida Hospital, where I was the director of the billing department in that hospital, director of billing, revenue cycle, registration, patient access. So, and that was my first leadership role, where I started as a supervisor and I grew into that role to become a director. And I had some amazing mentors there. The CFO there was a great mentor. My controller was a great mentor. You know, the person who actually recommended me to become a supervisor, she came and worked on she was hired to be the supervisor of the department. And then the first day she started working with me, she's like, Herold, how come you're not the supervisor? You couldn't do this job. I was like, oh, yeah, I know. But I didn't have as much experience as she did. And she was like, listen, as soon as I get promoted, I'm going to make sure you get promoted.
But you were a marketing major in college. And so, no, you laugh, but I was advertising.
Oh,
and so,
okay.
But it's different. And I don't think people realize that
completely.
Advertising at the University of Florida is in the College of Journalism. So I was really a journalism major.
Exactly.
So I'm a writer, and my minor was in business. You were actually in the College of Business as a marketing major.
Exactly.
So it gave you that business acumen to be able to, you took the accounting classes, you took the business classes, the management classes.
Absolutely.
You actually had some of that background as an undergrad.
Exactly. I did. And that helped a whole lot, especially when I started getting into the management classes, and I was very intrigued. And that's why I did my master's in management and leadership. I was like, oh, this is great. So it helped me a whole lot, because when I was the director of patient accounting, normally that role is held by somebody with an accounting degree,
That's what
accounting
I was thinking.
background. Exactly. But me, I didn't have the accounting background, but I had the experience, on the job experience, and I had the leadership skills to be able to help me mold and mentor. And my favorite part about the whole thing is mentoring. You know, I love mentoring.
So how do you find other people to mentor? Because I, along with Allison Ferris, I had Niraj Peru on the podcast, and he oversees the healthcare administration programs at Florida Atlantic University. And we talked a lot about mentorship. And we also talked about how difficult it is to hire people and figure out, like, do they actually have to have a degree in accounting? Do they have to have a degree in healthcare administration? Like, how do you find the right people in healthcare and bring them on board? How do you identify them? You were identified. As you've grown in leadership, how do you pinpoint the people that you want to mentor and develop, even if they don't have the educational background?
You know, I like to do group interviews. So the first thing is, it's my group interview. I go from group interview. And I don't go simply by your experience on a resume. I'd like to meet the person who's applying for the job. Normally, when I have a team, when it comes to hiring, I'll do the first interview. My first interview to kind of knock so I can find the best team members, the best candidates. I'll do personal interviews with all these individuals, whether it's in person or on the phone. And then I have my team who is the role who that individual is going to be in. I select team members who are in similar roles. And also, if there's a leader, another supervisor over that role, then they will do the group interview with that individual.
So it's a group interview, meaning that you are interviewing multiple people together, or that one individual is interviewing with multiple people within your organization?
Exactly. That one individual is being interviewed with multiple people in my department. And sometimes there are different stakeholders. Some of those stakeholders for that position, they don't work in my department. So I would go and talk to another manager or another director, say, listen, can I borrow Susie to be on this interview? Because I know she works very closely with this person. And that's how I do most of my interviews. And then when we select a team member to be on the team, it's a collective effort. It's not just Herold's idea or the supervisor's idea. It's a collective effort. We're going to hire this person, and we're going to create a roadmap for this person to be successful. Now, the teams I've built over the years, they know what my strengths are, which is into the leadership development aspect. So they know that, hey, you are going to handle this part, meeting with this person, the approach when they're communicating with patients, communicating with team members, their path, where they want to go. And then Susie Q is going to train this person on the actual job they're going to be doing, and this and so forth. So we always have a comprehensive plan for this team member to be able to be successful. So,
I struggle, and I'm asking for advice because Krista is our director of finance and operations, and I'm our CEO, and we're looking for specific candidates. Obviously, listen, I'm looking for a pharmacist right now, and somebody needs to have a pharmacy, right, license,
yes.
okay? But if I'm looking for somebody customer service related or even a medical assistant, that's very difficult to identify. And in Florida, you don't need a medical assisting certification. You can actually train someone to be a medical assistant for somebody answering phones or somebody greeting patients or somebody rooming patients or a principal care manager or somebody else where you don't need a specific degree. Krista and I have said, these are the skills we're looking for. But somehow those who are interviewing or identifying candidates are saying, well, but that person hasn't worked in a medical office, or that person doesn't have rheumatology experience, or and I'm like, get someone from Starbucks who has great customer service experience. How do you teach your team that you can branch outside? And sometimes your best team members are not those who have the experience in that specific area.
Absolutely. So I've learned this early in my career out in Health First. The great Jim Slate taught me this. He called it's the cross-pollination of skills. He would always say this, Herold, it's all about cross-pollination of skills. You can have someone who doesn't have the experience, but you can train them on the job, but they have the right attitude, the integrity, the grit that that person needs to do the job. Then you collectively as a team, you guys identify this individual, you provide them on-the-job training. For example, I've seen examples where someone said, oh yes, I'm looking for a medical assistant, but because this great medical assistant who has such great personality, who's so friendly and so kind and so compassionate, because they've never worked in primary care, they work in dermatology, we can't put them in a primary care office. I'm like, really? So you'd rather have a medical assistant who's been in primary care, but who has a terrible attitude?
I know. You and I are thinking the same thing, but I'm trying to encourage members of my team. Krista and I are on board with you, but members of my team who don't quite get the connection. So that's where my head boggles.
But let me just say this, though. So what we have to get in the state of mind whenever we hire an employee, we have an onboarding plan with them. So based on what background they have, we'll do an onboarding plan training based on the experience that they have. If they don't have any experience on the job, but they have an idea of it, so we know that we will take longer to train them. It's kind of like an institution. You become a school. You put them in the school. You train them on the theory. You train them on the practice. And then you put them in the field. So that investment, it goes a very, very long way. And I know I want to say this one thing. One of the biggest success stories I've had, when I first started over at Bethesda, because before the Baptist merger, I hired this young lady. It was me and a very long time healthcare administrator in Boynton. Her name is Mary Peed. She's she was the backbone of the community when it came to the practices over at Bethesda. Now she's retired, and I thank her for her service. We interviewed this young lady. She used to work in a security job for years, and then she went to school to become a medical biller. And Mary and I we interviewed her. We're like, out of everybody we have, this young lady, she's amazing. She doesn't have the experience, but we love her attitude. We love all these different things about her. So we hired her, and we were building a billing department at the time. We hired this young lady. She became the supervisor of the department. The whole billing department became her responsibility. She had like 20-something people she was responsible for. She was the coding audit person for all the practices. And it's one of the biggest success stories I've had, because if I were to say, oh yeah, just because she didn't have the experience, we wouldn't be celebrating the work that she's done today. So I agree with you.
Hence why you worked on your master's in leadership. So you left the University of Miami. Why did you leave them? And you ended up at Bethesda. So I'd love to understand that transition.
My wife made me.
What was her reasons. Why did she make you?
No, I love working at UM, and if I could have stayed there, we thought about moving down to Miami, and it was so expensive, and you couldn't really get a good house. And we were like, you know what? I'm coming home all the time, late, taking the train. Sometimes the train have some accidents, and we were like, listen, I'm gonna move down here.
And your son was probably how old?
Oh, my
at the
son
time?
he was very young at the time. So I was like, you know what, I'll work on moving here. And thankfully, the first position I applied for over at Bethesda at the time, and it was for an practice administrator in revenue cycle. And I didn't really have the practice operations experience that much, but I had some great people there at the time who believed in me. We had Dr. Beal, David Kalayuda, Mr. Kirk, and they hired me, and I was like, listen, Joanne Aquilina, can't forget Joanne. She was the CFO there, and I said, listen, you guys hired me. I'm going to make sure you guys are proud, because I'm going to do a bang-up job for you guys, and which I did. You know, I got some real good leadership from these individuals. The physicians, so some of my best mentors were the physicians within that group. You know, I had Dr. Lopez Viego, who was a mentor, Dr. George Mueller, who was a mentor of mine. So I started working there, and then just, you know, and from administrator, I became director, and I started having more responsibilities. And it was just a wonderful experience, and I loved every minute when I was over at Bethesda.
And Baptist acquired them.
Yes.
So what happened after Baptist came in?
So, you know, I love Baptist since I was at University of Miami, because I'm a person who believes in patient satisfaction. I believe in development of employees. And when I was at UM, some of my leaders, I know some of them might be hearing this, all you would be hearing them say, why can't we be more like Baptist? Why can't we be more like Baptist? And I didn't understand why, because I was not used to the Miami tapestry in healthcare. So then I started researching Baptist. I was like, goodness gracious, the employee benefits that they have, they publish all their patient satisfaction scores. And I just kept reading. I was like, this organization is amazing. But I was like, well, I'm never going to work for them since I'm already here at UM, and then I'm moving back to Palm Beach. So when I was actually at the interview, I remember they mentioned, oh, yeah, we potentially might do a merger with Baptist. But that was, you know, and then, you know, lo and behold, 6 or 7 years later, I was there doing the merger. And thankfully for me, I had a VP who was in charge, actually an AVP who was in charge. And I was the first person in charge, the second person in charge for the physician group for the merger. So I was in charge of the merger locally for Bethesda and Baptist in Miami. So because of my background in marketing, I had the pleasure of working with the Baptist Miami marketing department, the name University Baptist Health Medical Group. I worked on developing that name, developing the whole brand here in Palm Beach County, all the marketing. So I had a blast doing that, working with the team down south. And then also, the next thing I heard, oh yeah, we're gonna acquire Boca. I was like, oh, wow. So then our physician group, we had at the time 25 docs. And then when we merged with Boca, I think we became like 150 docs. And then plus we became part of the university, the Baptist physician group collectively. We were just massive.
Yes, and it continues to grow. So, what did you find was the biggest challenge with all of these mergers, especially when we talk about company culture?
Oh, that's the biggest. That was the biggest challenge, because I did so much research even before Baptists came to Palm Beach. I did so much research on the Baptist culture, who they are, how they are, and so forth. And the good thing is Bethesda had some similar things within Baptist as well, within the Baptist culture that were similar. So the culture, I was so, happy because of that. But even then, it was so challenging because, it's a merger. Once someone from the north start looking at the culture from the South, and they think they're better, and then they start putting their guards down. So the true Baptist culture, when I was there, it was in transition. It was still coming, but it's gonna take some time. I think it's gonna take some time for that true Baptist in the South to come here to Palm Beach County.
So you think it is possible, because life in Miami is very different than life in Palm Beach.
Absolutely.
And life in Boca Raton is very different than it is in Boynton Beach.
Absolutely.
And so you have Baptists who had such a dominance and rich culture in the Miami sector and moving upward through the state of Florida. Do you think it's possible to actually bring that culture, or do you think Miami has to give a little because they have to take a little from the Boynton area and the Boca Raton area?
So to a certain extent, I think, yes, both of them have to give a little. The best scenario is for you to take these two organizations, take the best part of each culture and then make it one, which would be, the best approach. But you're absolutely right. Each one have to give a little bit here and there. But I think the culture that's very important for all three organizations, when you're looking at Baptist, Boca, and Bethesda, the one great thing, not the only thing, but the one great thing that they have is the patient culture, because all three institutions care about patient care. Patient care is the most important thing to them. There's a major focus on that. So Baptists already had that, and these institutions already had that. So capitalizing on the patient care, continuing to provide the patient care, and Baptists to come up here to provide additional resources for these individuals to continue to provide that patient care in the community. I think that's the biggest win that all three of them have.
And now you're not there.
Yeah, I'm not there.
So you left the whole Baptist family.
Yes.
And you started something else.
Yes.
So tell me a little bit about that journey.
So, me leaving, it was bittersweet because I loved that institution. I grew up in Boynton, right there on Seacrest and 10th Ave. So it was such a pleasure, such an honor when I had to start a new practice in the community. This is my own community. I used to have my own budget for us to start new practices, for us to find where to plant practices. And that I loved that. I'm very thankful I had that opportunity. And now I'm ingrained even more in the community. So before I left, we were able to acquire our own practice here in the community to be part of a great institution that's been in the community for over 30 years. We do primary care, urgent care. We're open 6 days a week, and we continue to serve the community collectively, continue to provide them that great patient satisfaction. And I think what these different institutions have ingrained in me over the years, and I've been able to implant it into this practice. And from there, I spin off and I started my own healthcare consulting company where I start new practices. So far, within the last 2 years, I have about 50 new practices I've started and help develop from Central Florida, Orlando, all the way to Miami, and I've been able to be a part of these different institutions to bring these experiences. I think this is like the best experiences in healthcare that I can bring to small independent practices in our community.
What do you find is the biggest difference between the hospital setting versus the independent private practice setting?
Oh my goodness! When you So there's two differences. The first difference, when you are in a hospital, it's completely different as far as the care you're providing and when you are in a practice. And I used to think, oh yeah, the people in the practices, they have it easy. I couldn't get it. It's so wrong. I
laugh when you say that because I have this conversation all of the time, and those who work in the hospital are like, oh, it must be really easy and nice in private practice. And those in private practice look at the hospital people and are like, oh, it must be nice. Yeah. And then you have the academicians who are like, we're the elitists. And it's like, maybe walk a mile in my shoes and then be the judge of that.
Exactly.
So what's the biggest difference?
So they all have their challenges. The biggest difference, I would say, from the hospital uh, practice to the practice. In the practice, it's you have to once you're open, you're on. You have to be on all the time. You know, if you open at 8 o'clock, you closing at 8. You have to be on. Your patients are coming in. You have to answer the phone. You have to be attentive. You have to open that door and working all the time. So I think that's one of the biggest differences I've seen because it's. I'm sorry to say it this way. In the practices, it's a volume thing. It's a volume. You have to focus on your volume. You have to do your marketing to be able to get that volume through the door. And you have to also be prepared when that volume shows up. You take care of them. You take care of them great so they can come back and tell their friends. So you have to stay on top of everything that's moving to the practice. And there's a time. Everybody's clock. Everybody's clock. There's a time limit for each patient that's coming through the practice. Where in the hospital, it's kind of a little bit different. When someone goes to the emergency room, they know it's going to be a long wait. So they'll go in the back. They know what they're in for. Same thing in the practices. They know what they're in for, to go in and get out.
So do you think patient expectations are different?
Absolutely. Patient expectations are completely different between those two worlds.
And so how do doctors accommodate for that, or administrators, when you have physicians who actually go back and forth between the hospital and the clinic? And then on top of that, and I know this for a fact, Baptist has a lot of physicians who rent out space within the hospital. And so they're actually practicing as independent physicians, but they are under the guise, I would say, of the hospital. And I know this because it was a shock to me. A lot of the physicians will bill under Part B billing, right? Independent medicine, physician services, as opposed to through the hospital Part A. So it's not emergency room. It might be the urologist, or it might be the obstetrician who uses the delivery room in the hospital, but they have their own independent clinic and they're renting space at the hospital. So I guess what I'm thinking is the lines are really blurred for patients. So is it a benefit to physicians who rent that space in a hospital because maybe patient expectations are lower, or is it a detriment?
Okay, so from it's not, they don't rent spaces. Most of these providers, they're more of they're hospitalists, or they take calls from the hospital. Then they would go and see the patient in the hospital. Like if it's an ophthalmologist, they know they're on call and we have a patient who need them, so they'll go and see that patient and they'll bill the Part B and so forth. But their practice is not inside the hospital. They're just on call at that hospital. So you're absolutely right, because this patient now, guess where they have to go and do the follow-up? At that doctor's office. So, I'm not sure what the difference would be, right? Except for the fact that the patient know that, now I got to go to this doctor's office. Hopefully it doesn't take as long and so forth. But it's a different experience than what it would be in the hospital.
For those of us in physician services, right, in an independent practice outside of the hospital, what advice can you give to those administrators or those who are working in independent practice to better align patient expectations? Because we also get flooded with emergencies, right? We, especially in the world of rheumatology, we don't know necessarily if a patient is stable or a patient is not stable on their medication, or they're having a flare, or this is a train wreck coming in. We deal with a lot of snowbirds and they come in with like 130 pages of medical records because now it's October, right? What advice do you give?
Well, healthcare is very complicated, for one.
Yeah.
In South Florida, it's even more complicated because for the reason you mentioned, having the snowbirds coming here, they're coming with issues coming from another provider, and then now they're coming to see you, and you have to manage that. Or they haven't even seen a provider for so long, and you have such an aging population that we're dealing with down here in South Florida. So when we look at the data, you look into MGMA data, they'll tell you, the doctor needs to spend X amount of time with the patient, 15 minutes for a follow-up, 30 minutes for a new patient and so forth. But sometimes the data doesn't take into account the age of this population you're serving, because we're on East Del Rey where everyone is like 87 that's coming to your practice. I'm not expecting my doctor to spend only 30 minutes with this patient who hasn't seen a doctor within the last 6 months. Even further, you have the minority community that's completely underserved in Palm Beach County. They're coming from Seacrest and coming into the practice. They haven't seen a primary care doctor over the last 2 years, and they're coming to see you. You're not expecting to spend only 30 minutes with this patient. So the advice that and then at the other part of that is from a provider's perspective, who's an independent provider, you have to make a living. Mm-hmm. You have to make a living. Seeing 10 patients a day is not going to cut it for you. So the question is, what do you do? If I had a magic marker to give the best answer, I would, but I honestly don't have the best answer. Is that we do the best that we can to take care of the patients each and every single day. But one advice I would give is optimizing scheduling is very, very, very important. Knowing how to schedule your patients. Many providers don't take that into consideration, because if you're opening 8 hours a day, there's X amount of patients you can see. So you do have to take that data into account somewhat, that statistics that's provided by MGMA. 30 minutes for a new patient, 15 for a follow-up, and so forth, and based on the specialty. You have to take that into consideration and look to see how you can maximize the number of patients you can see for that day, meaning that you're not going to try to schedule 10 30-minute patients for the day, because now you are at a disadvantage. So therefore, you have to make sure you take the right approach, schedule your follow-ups accordingly, and schedule your new patients accordingly, and so forth, based on the patient type, so you can have the right amount of time to see the most amount of patient effectively, efficiently, and safely.
And that's what's difficult when I have a new fellow coming to interview and hopefully to onboard or bring them onto our practice, and they'll ask, how many patients should I see in a day? Or I'm like, I can't even talk about that. Like, it is very difficult because you have nothing to align that number with. Exactly. Because you've been in training for 12 years or 13 years, and you've had to do everything yourself. Now it's the support of a nurse, of a medical assistant, of an x-ray tech, of a principal care management team, and all of these resources, and you need to work at your highest level. Yeah. But then, and that at that point, I'm like speaking a foreign language. So
you're ready to break a fellow.
Yeah, I know, and I don't want to do that. I'm asking for advice, Herold, for a friend. What would you recommend?
Well, so that was part of when I was still part of my responsibility is hiring physicians. And we have to be honest and tell the truth. Many physicians are not used to seeing the financials. They're not used to seeing the numbers. They're not used to. Me, that's the first thing. When I started over at Bethesda, that's the first thing. I was like, listen, we're going to have to show these people the financials. How much does it take to run this practice? How much do we get paid per patient? How many patients we need to see for us to be able to break even? How many patients we need to see per month, per day? We had to break the numbers down. And at first, physicians actually appreciate that. A lot of people don't think doctors appreciate that. Because physicians are very competitive. When they know they have a goal to meet, they're like, oh, that's the goal? Well, let's see how we can do it. And more specifically, if they know Dr. John and Dr. Susie seeing more patients than Dr. John. Listen, I need to find out how we can maximize my schedule. They'll get more in the process, make it a more lean operation for them to get the physician involved in the whole entire process. Even with the scheduling, get the doctor to understand the scheduling matrix for the practice. So that's the first place I would start. If you have a provider in your practice, these are the financials. And I know sometimes from a corporate perspective, when the physician is employed, and it might be, there's different. It gets complicated sometimes to get into those things. But the truth has to be told to the physician. Okay, if you're making $250,000 a year, How many patients does that equal to? I'm sorry to put it that way, but that's the reality. How many patients do I need to see to equate to $250,000 for the year? And those are the type of information most physicians never receive. So you have to kind of feed it to them on a monthly basis, have the financial discussion. What did they produce for that month? This is what you produce. This is the number of patients you saw. That translates into X amount of patients per day based on the number of days you worked. You have to get into it.
And you have so much energy and you are continuing to pivot. This is so much fun for me. What's your next step? Where are you going after this? You do consulting for multiple groups and practices and physicians. You started a clinic in this area. What you doing next, Herold?
Well, right now, I'm getting my son to graduate.
So you can be an empty nester like me, right?
Exactly. So both of my wife are like, okay, let's send him to college. So he's in 11th grade next year. He's going to be graduating. So I take it easy as much as I can. Both of my wife and I, we try to stay local and do most of our businesses local. And if we do need to get away, we get away to handle them. But right now, it's building the consulting company and continue to provide great care in the community here in South Florida. I love South Florida. And you will not love South Florida the way you should love South Florida until you go away. You move away from South Florida. And then you're going to come back. You'll be like, this is the best place to live.
Yes, I was born in South Florida. I was born in Miami. And and when I was 5 years old, my parents had divorced prior to that. My mother is a social worker, and she said, to heck with South Florida, I don't want to be here. Minnesota has amazing mental health facilities, so she moved us to Minnesota.
Wow.
I lived everywhere around the country, went to the University of Florida. My husband and I went to Chicago for a year, and I said, to heck with this, I'm moving back to Florida.
Going back home.
And we've been in South Florida ever since.
Oh, wow.
So you're right.
Yes, I love
Once
it here.
in South Florida, always in South Florida.
Exactly. We're not moving anywhere. Both my wife and I, we grew up here. We've been here since we were kids, so we love it here.
You're staying here. Well, my husband's a Miami boy, so obviously he has returned back here as well. So I want to wrap this up, and with all of the changes going on in healthcare, you and I being devoted to South Florida, if you could create one change within our American healthcare system to improve it, what would that one change be?
The one change would be, to improve the payer relationships with the practices, with the patients. Payers, insurance companies need to do better by the practices and better by the patients.
I love that. I'm ending it with that because, wow, it makes me think and process, and I really appreciate your perspective. And most of all, I appreciate your enthusiasm. So thank you.
Thank you very much, Meredith.
Herold Figareau, thank you for joining me on Working Healthcare. If this conversation hit home or made you think a little differently, don't keep it to yourself. Share the episode, tag a friend, or post about it on social media. Connect with me on LinkedIn to keep the conversation going in between episodes. If you've got a question, an episode idea, or someone you think I should feature, send me a note at meredithhirsh.com. Thank you all for the 5-star reviews. They help more listeners find the show. New episodes drop every Tuesday. Subscribe so you don't miss what's next. Tune in weekly as we explore the inner workings of healthcare, because you can't fix what you don't understand.